Hi, everybody. Welcome to By The Book. It's an interactive webinar brought to you by our co-hosts and cousins, Peter, Danny, and John Boockvar. Peter is a CNBC contributor and CIO of Bleakley Advisory Group, and John is Vice Chair of Neurosurgery at Lenox Hill Hospital. He's also leading clinical trials in COVID disease and working on the front lines in the COVID ICU. Danny, John's twin, is president at Thrasio, the largest acquirer of Amazon third-party private label businesses, and has 20 plus years of experience leading fast-growing consumer businesses for global brands such as the NFL and Weight Watchers. Johnny, Danny, and Peter are all leaders in their respective fields and will be answering your questions about health, wellness, finance, business, and life during this pandemic. Please do keep these questions more general than specific, as we have lots of viewers today and want to make sure they apply to the majority. With that being said, to ask your host questions, please direct your attention to the chat function. It's on the bottom right of your screen. You can submit questions, and depending on the topic, John or Peter will answer them respectively. So without further ado, take it away, Boockvars.
Again, John and Dan are not affiliated with Bleakley Financial Group and Private Advisor Group, and nothing they say should be taken as investment advice. And certainly nothing I say should be taken as medical advice.
Thanks, Peter. I'm Danny Boockvar. Flora, thanks for the introduction. I'm president at Thrasio. I'm a consumer service executive, live on the Upper West Side with a wife and two teenagers, and I'll be moderating today's panel. John, over to you.
Thanks, Danny. Peter, thank you for that introduction, Flora. My name is John Boockvar. I'm a neurosurgeon at Lenox Hill Hospital, where we're on the front lines, obviously fighting this pandemic. The rationale for this seminar, or Zoominar as we call it, is to provide really an open forum to answer questions. Many of the questions are obviously health related and economic related. So as Peter mentioned in his disclaimer, we're not giving out investment advice, and we just want to keep everybody safe. This is a very open forum where you guys get to ask us questions, and we'll give you honest, truthful, we believe unbiased answers to your questions. I'm just going to start by giving an introduction, and please remember to turn your video off and your mute function off if you don't mind, so we can have an easy discussion. The atmosphere here in New York City obviously is intense, but there's also a relative calm to where we are right now. Being a couple of weeks into this surge, we have a better understanding of what we're dealing with. And I will tell you, just to lead the conversation, there is a ventilator for everybody right now. And I think the most important thing for the public to know is that we're getting better at treating these patients. We have a better understanding of who our enemy is. And frankly, a lot of the medications are working. I will tell you something that we started doing, which I think is just terrific. Every time we extubate a patient here at Lenox Hill Hospital, or a patient is discharged, we play the Beatles song, "Here Comes the Sun," over the loudspeaker of the hospital. And when we hear that song now every couple minutes, it's really uplifting. So in general, it is an intense environment. We're all working extremely hard, but we're making progress, and we're discharging a lot of patients. So I think that really is fundamentally from the front lines what I want to convey to the American public, that despite the large number of deaths that we're seeing, our hospitalization numbers are going down, and that portends, today's Friday, by mid next week, we see a significant drop in the death rates, at least here in New York and New Jersey. So that's just sort of where, compared to where we were last week. Even compared to where we were last week, we're having better experiences with some of the drugs that we're using. We're knowing when to use hydrochloroquine, which many of you guys know is in the news quite a bit. There is some rationale to use hydrochloroquine. It's not necessarily a game changer, but it does have some anti-inflammatory and antiviral activity, and what we're trying to figure out is who to use it on and when to use it. And this kind of experience is developing really day by day. So we're really getting a much better understanding of this disease. and how to treat it. I'm going to just stop and remind people that there really are two ways we treat this disease. One is with antiviral, which is where we use drugs to target the virus. And the other is anti-inflammatory, which we're trying to prevent something called an inflammatory or cytokine storm. And we have a lot of drugs, and we're going to hear from an expert in biotechnology later today on the show, who's going to give us an update in the biotechnology space. So we're all working extremely hard. There's sometimes mixed messages on media, but I will tell you, the healthcare providers in this city and Long Island and Westchester, now all over the country, they are very stoic, they're very courageous, and they're very good at treating the individual patient. And I can't emphasize enough that we're doing better than we were last week at understanding this disease. We're doing better. We have enough supplies for the most part. And again, there's a ventilator for everybody. So I think if we just remember that fact alone, it should give people some peace of mind.
Thanks, John. And I think the stock market rally over the past couple of weeks is sort of seeing the optimism that John just talked about, both in terms of reducing the patient count and also some positive early results in some of these therapeutics. And I think that explains what we've seen, and that the market is beginning to look past the worst of the virus and trying to figure out what the other side is going to look like. The other side being when the economy starts to reopen again, at the same time balancing that we still do not have a vaccine and the health implications of that, but slowly and gradually begin to open up the economy. And it's not going to happen anytime soon. We're talking about probably early May. But if you look at some of the countries in Europe that have gotten a handle around the virus, particularly in Spain and Italy, Austria, Denmark, the Czech Republic, even Germany, all of these countries have begun to lay out plans how to reopen. And again, it's going to be very gradual. It's going to take months. There are going to be setbacks. And a lot of this reopening is going to start very small in terms of the businesses. It will be the local hair salon. It'll be the local clothing store where parents can buy their kids summer clothes. It'll be the local auto mechanic if they haven't been open. The bigger picture events like baseball or a concert, that's going to be sort of at the back of the line, so to speak, in terms of what opens. So once we start this process, the markets are going to try to sniff out is how is the economy going to unfold from there. I think there's an assumption that it's going to be slow, that you're not just going to flick a switch and the economy is going to be off to the races again. Because also this type of experience alters behavior. The consumer that was spending X before, well, they're probably going to be spending Y now. They're going to be saving more, particularly if they lost their job and they haven't gotten that job back. They're going to be very reluctant to go out and spend money. And from a corporate perspective, after years of a lot of leverage being taken on, companies are going to be shifting their focus on improving their balance sheets, which means that it could be a slower rate of hiring, could be a slower rate of capital investment, and the growth rates that we saw prior to this are not going to be realized. It's going to be a slower pace going forward. So now that we've had this rally after the sell-off, it does become more difficult from here in terms of getting the markets much higher from here, but a lot of that will be determined at what extent, what pace, and what duration we can unlock and reopen the economy again. So I'll pass it to Dan for questions.
Thanks, and we have several questions. First question is for you, Johnny. Do you agree that much more testing has to take place before people go back to work?
Absolutely. So there are two elements to testing. It's point of care testing for exposure to the virus, and then there's going to be point of care testing for recovery from the virus. And both are equally important as we take our foot off the pedal of de-distancing. And when you look at the relative exposure of the community to the virus, you need what we call point of care testing in your doctor's office or in an urgent care facility, where you can see if you're being exposed if you're positive for COVID, much like you would take a strep test if your child had evidence of maybe having a strep infection. And obviously the widespread rollout of that kind of testing has already been accomplished. But as we come out of quarantine, everyone's going to have to be able to be tested for that positivity. Keep in mind that the false negative rate currently hovers in the 20, 25, even 30% rate for these tests. So they're imperfect, and they involve taking basically a pen-sized swab and sticking it deep into the nose and then twirling it to the back of the nose. So it's uncomfortable for the patient. It's actually uncomfortable for the provider because it has some exposure risk. And so it's an imperfect test. What's actually more important, I think what the viewer asked is about antibody testing for those who have been exposed and recovered. All of us will develop antibodies to a virus once we've been exposed to it. They consist of two types of viruses, essentially. Something called IgM, which is your early antibody, and then IgG, which is a late antibody. And that late antibody is what gives us sustained immunity to a virus like the coronavirus. And the testing currently does not exist in a very good form where we can have widespread testing of both the healthcare workers and then, of course, the population at large so we can get back to work. As you can imagine, the healthcare staff has to be the first to be tested. We have to know whether we can, first of all, if we're immune, and then if we can go back to work safely. And of course, we have to roll this out in the general public. Anthony Fauci did say today that large-scale antibody testing is being validated. There are many, many companies who are testing this. In fact, it's my understanding that the FDA actually doesn't even regulate some of these testing kits. So you may have some companies, some states, the UK bought millions of these antibody kits that turned out to be faulty. So it's going to take a couple more weeks till we fine tune that antibody test. And then we'll be able to take our foot off the brakes of quarantine and allow us to slowly re-enter society, both in the healthcare field. Remember, we have no hospitals that are doing regular healthcare right now. All we have in New York City are COVID hospitals. So there's going to be a huge surge of healthcare that has been put on pause for the last 4 or 6 weeks, and we have to be ready to do that. So just as much as the restaurants have to open, the hair salons have to open, and the banks and et cetera, our hospitals, our urgent care centers, our private doctors' offices are all shuttered right now, and they have to be allowed to open. So we need that antibody test. One thing I will tell you, though, is not everybody develops an antibody to every disease. And just because you develop an antibody it doesn't mean that it's an antibody that is working forever. So there are some very specific details that need to be validated before those antibody tests roll out. But obviously that's part of the armamentarium of getting our economy, like Peter said, back on track.
Hey, Johnny, I have a question. Yesterday's Times showed that actual heart attacks and strokes are down in New York, and that the doctors are confused as to why the actual inpatient heart attacks and strokes are down. Do you have any thoughts on that?
Yeah, we saw strokes start going down almost immediately after quarantine across the nation. And with our colleagues, we were scratching our heads why strokes would plummet. We talked to our cardiovascular colleagues, and they were seeing the same thing for myocardial infarctions or heart attacks. And frankly, one good thing about coronavirus, it's been, this massive placebo effect on the nation. And perhaps it's because everyone is not racing to catch a bus that's pulling away or having their boss yell at them because they're not at work, and their blood pressure may be more stable or whatnot. But it is undeniable right now that the heart attack rates and the stroke rates of the last month have plummeted. And I hope that when we all go back to real life, if you will, that we don't see a massive uptick in those numbers, because that alone would be devastating as well.
Great, thank you. We have another special guest. Kathy, are you on?
Now I'm on.
Hi.
Hi, Kathy.
Kathy.
Hi, Kathy.
Hi, Boockvars.
Hi, Kathy. I'll introduce you, Kathy, and then I'll hand the floor over to you. So I'd like everyone to meet Kathy Boockvar, our big sister, Johnny and I's big sister. Kathy is the current Secretary of State of the Commonwealth of Pennsylvania. Previous to that, you were the CEO of Life Cycle Women Care. And before that, you were a candidate for U.S. Congress in your district in Bucks County. Kathy, we'd love to hear from you and your perspective on what it's like to be in government during this crazy time. So over to you, and then we'll have some questions for you.
Sure. Thanks for having me on the show. So at Department of State, well, first of all, what I want to say is this. Whatever impression anybody has of government bureaucracy, what it is or it isn't, it probably is very different than what's happening in almost every state capital across the country right now. And I could say for Pennsylvania, one of the most inspiring parts of this, and in such a difficult time, it's really important to find the silver linings, is that I've never seen such outstanding commitment and creativity and dedication and working around the clock, nights, weekends, whatever it takes, to find solutions to uncharted territory of problems. So Department of State in Pennsylvania oversees elections. We oversee professional licensing. Those are two areas that are in constant flux right now because of COVID-19. We also oversee professional filings for corporations and charitable organizations. Obviously, businesses are tremendously hit by the pandemic. So it has been constant, and I hope I never have to call my chief counsel at 3:45 in the morning again, but boy, was I glad that he took my call. So I'm happy to answer any questions, but I just really want to say that in Pennsylvania and across the country, and I'm very close contact with Secretary of State across the country, people are really working every moment of every day to help us all get through this.
Kathy, this is not a trick question. In New York, our Secretary of State is charged with overseeing the state's cemeteries. And actually, it's been a big problem in New York about burials. No joke, are you in charge of the cemeteries in the state of Pennsylvania?
I mean, we license cemeteries, and yes, so it is no joke. And one of the most so we've been in Pennsylvania. We've already issued more than 30 waivers of various regulatory statutory provisions governing all kinds of professional licensures. One of the most difficult, just even in terms of processing how to talk about it, dealt with times within which people need to be buried, and enabling families to grieve is very different in a time where we're all restricted in how many people can gather. So we've been working with the funeral board to really make that be as open, as flexible a process for the families, for the funeral homes as it can be under the circumstances.
Hi, Kathy.
Kathy, I have a question. Pete, you're up first.
Yeah, just a question. So how do you foresee in the coming months from that state level, how are you going to balance the obvious care and worry about the health spread of this, but at the same time try to slowly and gradually reopen businesses again? How does that balance really happen and unfold from here?
It's a great question, Peter, and it's something that we started working on before you knew exactly when the surge was going to happen. And so we've had very strong collaborative work groups among, so I have twice weekly cabinet meetings, and then there's multiple daily meetings of small portions of collaborative agencies. So Department of Health, Department of Insurance, Department of Revenue, Department of Labor, DCED, which is Community and Economic Development, Department of State, and so forth, all working together to both get through the now and then plan for the transition out. And as I'm sure you know, it's extremely, extremely difficult. And Governor Wolf in Pennsylvania has really tried to take a measured approach where he didn't shut down everything all at once in the state. He worked by region and basically tried to shut down the businesses in the regions that were hardest hit first, gradually extended it to the whole state. And same for the stay-at-home orders and so forth, closing of schools. Eventually everything went to all state. But Peter, what I think is going to happen is there's going to be a gradual reopening of things in the opposite direction. So I think nobody's going to go from 0 to 100, right? Or from 100 to 0. Because that's just asking for difficult transition out and to make sure that we're staying safe. So I think what we'll see either regional or limited openings. And for professional licensing, it's been very interesting because our waivers have not only focused on healthcare workers, though that's a huge part of what we've been focusing on, but we're also focusing on businesses and other professions who have been hit incredibly hard by this. So we gave extensions for renewal deadlines to nonprofit organizations, to barbers and cosmetologists, and all kinds of different professions to make sure that they have the extensions of time and aren't hit even harder by something that obviously none of us have control over. So I think
Hey, Kathy.
It'll be gradual.
Kathy, one question I got last week was from a senior citizen who was concerned about their muni bonds in their portfolio, having moved most of their investments to bonds. They were nervous about states going bankrupt. I guess Peter and Kathy, I'd love your thoughts on that.
I'm going to defer to Peter on this one. I mean, that, I think it's going to vary tremendously state to state. I have very high confidence in Pennsylvania's fiscal responsibility, and I don't see that happening here. But Peter, I'd be curious to hear what you're hearing across the country.
Yeah, it's going to be state by state, city by city, locality by locality. And certainly, everyone has experienced a very sharp decline in revenue, and it's now you have to make as a state, and Catherine, you've seen this, the difficult choices of what spending you cut to offset the big drop in revenue. And certainly some states went into this in different financial conditions, and so each one will have to manage through. Now, of course, if you own a muni bond that is related to the airport, that's obviously going to be under pressure, or a muni bond related to a subway system. But if you're in a muni bond that's related to water or some other necessities, or just the general taxing authority of a state or a city, I think you should be fine. But it is going to be a very tough balance for the spending cuts that need to take place to offset this big drop in revenue. Now, the federal government, at least through the Fed, have now taken steps to ease liquidity restraints and other issues that the municipal bond area is experiencing, and that could get deeper if states continue to run into issues. The other issue that a lot of states are going to face is the underfunding of their pensions because of the decline in the markets. Certain states had underfunded pensions going into this, and with the decline in stocks and some areas of the bond market, that has now been worse. Now, that's a long-term thing that they're going to have to balance, but I guess my point is that it's going to be very differentiated depending on what state, what city, and what the financial condition was going into this.
Makes sense.
I have one question for Kathy, Danny. Kath, so just give me your experience as a consumer of healthcare goods and services, competing with the likes of your neighboring states and FEMA for ventilators, and what do you suggest we do for the next pandemic to avoid bidding war between Pennsylvania and New York and New Jersey, and then seeing FEMA come in and outbid you? What's the answer?
How much time do you have? I think it's a good question. I think that there is really a combination of things. I mean, I think one of the things that will come from this is that there'll be more COOP planning, continuity of operations planning. And I also think from a professional licensing standpoint and facility standpoint, there'll be more ability to kind of flex and, learn from. We don't have to recreate the wheel. I hope we never have to use any of this stuff again. But I know that you were talking before the federal government moved on the what was it called? The Federal Purchasing Act.
The Defense Production Act.
Yeah. So you mentioned that before probably half of the country had ever heard of that, and then it moved forward. But I have to say it's been a highly imperfect rollout for sure. It seems to me that the only way to do this in a way that makes sense is to have collaborative, distribution of the equipment and sharing of the equipment as the surge is rolling out differently in different places. Again, I think the COOP planning for us, the COOP planning is a huge part of what we've been doing in elections for years. But it hasn't been seen, I think, at this level, cross-agency, cross-sector, in the intersection of healthcare and licensing and budget and finance and all those will have a better, I think, integration and understanding, frankly, of what each other do. And so I think to the extent that any of this knock down silos, that's going to be useful going forward. And again, I hope we never need it, but that's the whole point of COOP planning, is to be ready, for the next time.
Kathy, tell us, you just recently delayed the Pennsylvania primary to June 5th. What was that like?
June 2nd. Don't misinform the voters, Daniel.
Okay, June 2nd. What was the original date, and what was the process like to move that?
April 28th was the original date, and it was challenging. So basically, Pennsylvania is a decentralized system of elections. So Department of State oversees elections in conjunction with each of the 67 counties has their own holding of elections and election offices. And so we work very closely with all 67. And, for many weeks, many of us were urging that this happen, that we move the primary. And the tricky thing is, in Pennsylvania, like in many states, there's not clarity in the statutes about who gets to make those decisions. In fact, it's extremely rare that you find changing of election dates. So, there was some conversations about basically whether it should be done by executive order and so forth. And in the long run, the right decision was made, which was to work together collaboratively with the legislature. And the legislature and administration and Department of State together created, not only changed the date of the election, but also added provisions into what's called Act 12 of 2020 that advance elections on numerous fronts. So changed the date of the election, also allowed for greater flexibility for the primary day for the counties. So for example, it makes it easier for counties to find poll workers. It makes it easier for counties to consolidate polling place locations. And it makes it easier to count the mail-in and absentee ballots. We just passed a law in the fall in Pennsylvania that allows any voter to vote by mail, whether they have an excuse or not. And so even before COVID-19, we were expecting a great increase in mail-in ballots, but now, of course, it's going to be off the chart. In fact, it's already have more requested mail-in and absentee ballots as of today than were cast in the general election in the last 3 presidential years. And we're 8 weeks out. So there's going to be a huge influx. This law that we passed collaboratively with the legislature made all these changes so that we're not just planning kind of one day at a time. This is not something that's sort of once and done. This is something that we're monitoring every day, knowing that we may have to make adjustments as we go.
Super. Thanks, Kath. With that, we're going to move back to some medical questions, and I'm going to pass it over to you, Johnny, from a friend of ours whose husband recently had COVID and wants to know about plasma. And she hears that hospitals need plasma from recovered COVID patients, but she's having trouble finding a place to test and take her husband's plasma now that he has recovered. Any suggestions as to where to turn?
Sure. So convalescent plasma, as it is called, is essentially the plasma or blood of a patient that's been recovered from the coronavirus. The benefit of having that plasma is there are antibodies in the plasma that can neutralize the virus, particularly for someone who's very, very sick. And all the data that came out of China using this technique is limited. We are rolling this out in the United States, particularly in New York, as a treatment, particularly for the very, very sick. What it entails is if you have recovered from COVID-19, you can actually donate blood, much like you would donate blood, and your plasma would be used to provide antibodies to the very sick. The Northwell, which is the state's largest healthcare system with 24 hospitals, has a program up and running, will be up and running actually early next week. So if you're interested and live either in Manhattan or Long Island or Westchester, you can reach out. And on my Twitter page, which Flora will post to the group chat, I can help you get to a site where you can donate convalescent plasma for treatment. Mount Sinai here in New York City also has an up and running program. And the program really came out of the Mayo Clinic and Johns Hopkins hospitals in Maryland. So it is going to be widespread throughout the country where we will be trialing convalescent plasma for the treatment of severe COVID. Whether it works or not remains to be seen, but we are rolling out that treatment. Danny?
Great. Another question just came in about, can you test, let me just make sure I get this right. Actually, Peter, over to you. Do you think the markets have bottomed out?
Well, a few weeks ago, for sure. Now that we've basically gotten back half of what we lost, I think it becomes more challenging. I think the market is going to shift its focus from the original sell-off being virus-driven, economic shutdown-driven, to, wow, there's some light at the end of the tunnel in terms of patient counts declining, progress on therapeutics, and now we're reaching plans of slowly reopening. But now the next test is what the pace of that reopening will be. That's really the next test. So I'm not convinced that that the worst is over in the markets. A lot of that will now be determined more so by how does the economy unfold from here, now that we feel like we have our grips around the direction of the virus from here.
Got it. Johnny, question for you. Can you have pneumonia and test negative for corona? My friend's father-in-law is in the hospital with this.
So the answer is nowadays, if you have pneumonia, you have COVID. If we were in the middle of the influenza season, which runs from September to April, there would be a possibility that your pneumonia was non-COVID related. That being said, just to reiterate the differences between the influenza virus and the coronavirus and what we're dealing with now, influenza runs essentially from September to April. It's give or take a 6-month course of infection with the influenza virus. Just to give you perspective, the last pandemic that we had in this country was the H1N1 pandemic in 2009. We lost in 1 year, from April of 2009 to April of 2010, we lost 12,000 Americans to the last great pandemic, which was over a year, to H1N1. Of course, as you know, we've already lost 16,000 plus Americans to the coronavirus pandemic in about 3 weeks. So just to look at the fatality rates, comparing the two, H1N1 was a much less lethal virus. What's interesting about H1N1, which I did not know, is it did not target the older population for the most part, because apparently if you were born in a certain year, you had had previous exposure to a very similar influenza strain that was very similar to that year's H1N1 that conferred some immunity and protection of the older population back in 2009. So obviously that did target a younger population. We now know that coronavirus is targeting a much more vulnerable population, in particular the elderly. So the answer now, if you come into the hospital and you test negative for a COVID test, you have a 30% chance of having a false negative COVID nasal swab. So you will be treated as if you are positive coronavirus, even though you have a negative test. So pneumonia currently is treated as coronavirus positive, regardless of the positivity of the test.
Two questions, one question, but it applies to both you and Peter. But Johnny, we saw Singapore shut down its economy again yesterday, and it looks like South Korea and Japan are also seeing rebound infections. So talk to us about that. And then Peter, what do you think the economic impact of those follow-on shutdowns looks like? Johnny, you first.
Yeah, and then we'll get to our special guest after this, who's a great biotech pharma guest, Umar Rafat. So there was a disturbing article in Bloomberg yesterday about South Korea seeing reactivation of the virus. And I didn't like that title because it's giving the presumption that you can get reinfected even though you developed immunity. I want the audience to know you're one and done here. If you get infected, you're essentially immune unless there's a massive mutation of the virus. And this is not a virus that's mutating quickly. So again, the article, I think, misstated the false negative rate of the test, meaning that up to 30% of people can still be suffering from coronavirus, even though their test comes back negative. Now, those patients may subsequently test positive, and they were always positive. So if you get the disease and you recover and you develop antibodies, as all of us essentially do, you are immune. You can't get this virus again. It's as if you've been vaccinated. Now, you may need a booster someday, like we need for certain viruses, but this particular infection can give you years of immunity with your antibodies.
And Peter, the markets haven't priced in any secondary shutdown in either China, South Korea, or Singapore.
Yeah, I mean, Singapore and South Korea are real great examples of how each country went at containing this. Singapore, from their experience with SARS in 2002-03 that really afflicted Hong Kong, and Hong Kong learned the same thing, was they were very quick in preparing themselves for this. Just the second they heard about a virus spreading in China in late December, early January, they kicked into gear, well, at least Singapore did, in terms of the testing side, and Hong Kong as well. So what we're seeing now with Singapore having to, which mostly was open, and how having to close up again, we're going to have to maybe get used to that here, and that this is not going to be a smooth reopening, and then there are going to be bouts of it popping up again, and things are going to have to close down again for 2 weeks, and maybe reopen and then close down. I mean, this is going to be hopefully, a few steps forward, but definitely steps back. South Korea was late in coming around to this, but did a tremendous job in catching up because their testing capabilities were so impressive that they were testing more people per capita and on a daily basis than any country in the world. So they then got their hands around it. But again, they're experiencing what Singapore is, and even Hong Kong having to announce some of these. So it just proves how gradual and bumpy this ride is going to be in terms of reopening until we have the proper therapeutics, and certainly until we have a vaccine.
Thanks, Johnny. Over to you. You want to introduce the next guest?
Umar, are you on the call? Umar Rafat, if you're there, chime in. If not, we'll continue answering questions. Okay, let's go to some more questions. He'll pop in shortly.
Okay, super. Peter, how do you think the U.S. trade policy will change going forward? And do you think the impact of this will positively impact the growth recovery of the U.S. economy?
Well, trade policy right now is obviously trying to convince U.S. companies to diversify their supply chains out of China into other countries with the hope that they bring more things back to the U.S. That's something, though, that is going to play out over many, many years. But there's no question that this virus, particularly if you're a pharmaceutical company that procured a lot of your raw materials from from China or even India, for example, you're going to well diversify that supply chain going forward. To the point about an economic rebound in the U.S. relative to the rest of the world, it's going to be very slow. I mean, we just have to deal with the reality that this is going to be a very staggered, fragmented recovery and reopening. And I think the real test will be is, so what we talked earlier about the first things that are going to reopen, you know, the local store, the local hair salon. The last thing that is going to reopen are the large gatherings, the baseball games, the casinos, the cruise lines, the concerts. Once you get to that, then you can feel confident that, okay, the economy's turned the corner. But until then, it's going to be a slow slog, unfortunately, until we get to that point.
Thanks. I can tell you firsthand, for someone who runs a business that involves China manufacturing, our February was very, very difficult. There's China shut down and the factories, they're shut down. And once China did come back online and the factories started to produce, we had the next challenge was that Amazon, which is product into their warehouses, because there was so much activity. And so for those of you who are buying on Amazon, it's been a very interesting process, but the idea of diversifying away from China has become mission critical based on the COVID rollout, because you have really the only place in the world to get things manufactured is China. And when China shut down in February, the world's economy shut down. Luckily, China came back quickly, and now you see the impact of it as okay.
I just got word. I just got word that Umer is going to be signing in a minute. So why don't we go to one more question and then we'll introduce Umer.
Okay.
And I think your video is slow, Danny.
Okay, again, keep firing away questions. Johnny, should we be concerned with the rush to make a vaccine? Okay.
Should we be concerned to make a vaccine?
Should we be concerned with the rush to make a vaccine and possible complications like happened with the rush? Yep. Yes.
You cut out a little bit, but the answer is, and this is a question that
can you hear that? Peter, can you hear me okay?
Yeah, you're slowing down a little bit, but we're going to ask this of our guest next. Umer, are you on the line yet or not yet? He's a minute or so away, but just to start.
Answer Tamika's question from Corey. How does social isolation impact health outcomes?
So I'll take that one, Flora. Thank you. Obviously, social isolation is extremely important. Is one of the reasons why we're doing as well as we're doing in the hospitals right now is because all of you are Zooming in from home. And the real question will be is, when do we stop Zooming and return to the restaurants and theaters? And, you know, Broadway is supposed to open on June 7th. And is Broadway ever going to be the same? Are we ever going to go to a theater again where we're not, you know, sitting in alternate seats? So there's no doubt that when you look at any pandemic, the mitigation phase, which is what we're in right now, involves social isolation. And it is single-handedly the most important thing that we've done to, as everyone knows, to flatten the curve. The question is, once we're done with mitigation, as Scott Gottlieb has talked about, which is a terrific read of how we get out of this phase and move into what we call phase 2, where, as Peter says, we start opening up the government, the healthcare system, and society. We're going to go to a restaurant that is 10% capacity, and then 25% capacity, and then 50% capacity, and so forth. So social isolation is the key here for mitigation. Umer, whenever you sign up, whenever you are, and just come on in and introduce yourself if you're not here already. But the idea of rushing to a vaccine is extremely important. Until we have either herd immunity or the entire population vaccinated, this will be a massive problem for all of us and the economy, meaning that if you remember, influenza came in 3 peaks. And I told you about this in 1918, the Spanish flu influenza came in 3 peaks, and it killed many, many, many people during each peak. And in fact, the later peaks were worse than the early peaks. we're in the first peak of this viral pandemic. And if we don't do things correctly, we're going to have multiple peaks with multiple problems. So the sooner we get a vaccine, the sooner we can all go back to life as normal for the time being. And there is a considerable rush to get the vaccine. Of course, it has to be proven to confer long-term immunity, and that requires months or even years to prove that. So that's why it takes so long. It takes 12 or 18 months to develop the vaccine. But we're working hard on that. Our guest will opine a little bit more about the vaccine. One more question, Flora.
Yeah, so Carrie is asking, what do you think about states ordering ventilators and having the federal government take the supplies from the states?
Well, look, I don't want to be political, and I don't know the details. I read, obviously, Colorado had a problem yesterday where they had placed an order for ventilators, and FEMA had then outbid them. FEMA basically can outbid any state when it comes to medical supply chain, and FEMA said, well, we're going to take these ventilators, put them in the stockpile. Then they basically shipped Colorado 100 ventilators. So it's a horrible system and one that should never happen ever again. This is a federal war that should be fought on a federal level. And there should never be an opportunity where Governor Cuomo has to outbid Governor Murphy or Governor Wolf in Pennsylvania. So hopefully we've learned our lesson with a virus that relatively spares human life, because the next avian flu that comes down the pike is not going to be so kind to everybody. So we have to use this as a learning experience. Okay.
A question from Rachel. What do you know about blood type being a determining factor affecting outcomes when infected with COVID?
I do have a research team on the phone, on the call. So Noah Reichman, are you on the call?
Look into that.
There he is. I'm going to use a lifeline, and I'm going to give you this question. So Noah, you're going to answer Rachel's question, and you have exactly 10 minutes to get the answer. So good luck to you. Thank you. Umar, I'm going to ask you, are you on the line again? I know you're telling me you signed in. So Umar, if you're there, come introduce yourself. Still not here. Okay, Danny, take it away.
It's okay. Peter, hopefully the connection's better. Peter, yes or no, you buy cruise line stocks or no?
I think the cruise line business will be one of the last to recover from this, and that is likely, most likely, a 2021 event. So if you have a 3 to 5 year time horizon, that's one thing. But if you're expecting an immediate, quick rebound in their business, that's going to take much more time.
But Boeing, you buy Boeing.
Well, I don't want to comment on an individual name, but
okay. But at least the idea that a company like Boeing and in a duopoly like that, the federal government would step in and support Boeing, which it has, but the cruise lines incorporated in international.
No question going forward. I think the point is that balance sheets are very important right now. And you want to be in companies that are going to get to the other side, both in terms of their business model and their balance sheet.
Danny, can I ask a question? Can I answer a question on masks?
You bet.
So I just want to up to bring everyone up to date on masks. To me, there's no controversy here. Masks are protective, both for the infected and for the uninfected. And I had tweeted maybe a week or two ago that I thought May should be National Mask Month. When we start releasing all of us out of quarantine, do yourself a favor, particularly if you are part of the population that is vulnerable, if you're immunocompromised, if you're above the age of 60, if you've ever smoked, you are particularly susceptible to the effects of COVID-19. Wear a mask. And when I say a mask, it can be a surgical mask, which is this. We wear N95 masks, which are these. But even if you have a cloth mask, which is something like this, all of them reduce both the infected person from blowing aerosolized viral particles out of their mouth, and of course from you inhaling aerosolized viral particles if you're close to someone, or more importantly, taking a viral particle off of a handle and putting it on your face or in your mouth or in your nose or in your eyes. So I can't emphasize enough that masks are going to be an important part of our re-entry plan. And this has been adopted in China and elsewhere. But it is extremely important that if you, in particular, are a vulnerable population, please get used to it. It's not the easiest thing to do. I find myself sometimes coughing because I'm wearing a mask. Sometimes I have trouble catching my breath because I'm wearing 2 masks. So it does take some getting used to.
And it's been a big key to the success of Hong Kong and South Korea and Singapore, as you mentioned earlier, in Taiwan, of just a culture of knowing to wear masks and the importance of it.
Johnny, we've seen that in urban areas that have worse pollution, the impact of COVID is more significant. I gather you're not surprised by that.
I'm not surprised by that. In fact, anything that predisposes to irritation or lung injury, what's interesting is we're finding that ever smokers, meaning that anyone who's ever smoked, even if they don't smoke now, is particularly susceptible to COVID-19. Remember, we talked about this in the beginning of the webinar, that the virus does one thing, but the inflammatory cascade that is initiated by the virus really is what kills people. And if you have any irritant, whether it's pollution, smog, vaping, or smoking, or you have some other disease, whether it's autoimmune disease, sarcoid, lupus, they can all predispose to lung injury or lung susceptibility, if you will. And those patients are going to be particularly hurt by this virus. And that is exactly the population that should be walking around with masks.
We have a question here. A lot of people I know are pushing elderberry syrup since it may have some effect on lessening colds. We've heard that a lot about zinc also. What are your thoughts?
What kind of syrup?
Elderberry syrup and zinc.
Well, zinc, the question is, does elderberry syrup or zinc offer some protection? I think, I don't know what elderberry syrup is, so I'm going to have to punt that one and ask Noah maybe to answer that one for our next time. But zinc, there is some data that zinc can potentially interfere with the viral particle and replication. The data is surely equivocal, and again, I don't recommend prophylaxing, if you will, with zinc at this time.
What about allergies? Since we're entering into allergy season, any more susceptibility given if you're allergic to COVID?
So I think we're still learning about this, what we call a cytokine storm. Cytokine storm is when, the way I describe it for lay people, it's why some people become anaphylactic essentially to some irritant and other people have no reaction, that everyone's immune system reacts a little bit differently. We're seeing what we call a cytokine storm in some of these patients, particularly some of these younger patients, where like this, they go from walkie-talkie where they can breathe, and then all of a sudden their lungs are essentially filled with inflammation. So that may have something to do with that allergic state or that asthmatic state. Again, we don't know the answers to these questions that you're asking. And we don't know, the Post was running these horrible, stories of these young people that were dying of the coronavirus with no underlying conditions. We just don't know really what their basic pulmonary status was to understand why those patients were susceptible. But really the answer is every one of us has a different immune system, and every one of us unfortunately has the ability to have a very, very outrageous response to what we call an antigen, and that can lead to death, unfortunately, and that's what we're seeing in these patients with cytokine storm.
Super. Before I ask one or two of the final questions, do you want to check again if Umar's on, or?
Umar, are you on the call? He may have had trouble. We'll bring him on. Umar is Rafat is a terrific, basically the number one analyst in pharma these days, and was offering insight into some of the biotechnology space as it relates to COVID. But since he either had trouble getting on the call or was occupied, perhaps we'll bring him on next week or in a later show. So why don't we finish up with some other questions?
I was going to ask him about the Abbott and Adaptive Technologies partnership. We know the folks at Adaptive Technologies, but we have a question about, has the new Abbott test for COVID increased the accuracy of COVID-19 testing? I don't know how much you know about that.
You know, I don't know the answer to that, but Umar would know the answer to that. And my understanding, it's a very good test with good sensitivity. So I have not seen that test, so I'm going to defer the answer to that question until we have Umar as a guest. Whoever answered that question, though, if you want to ping me and message me, I'm happy to get you that answer as soon as I get it.
Yeah, I believe that's the test that gets your response within 15 minutes, specifically from Abbott.
Okay. Noah Reichman, do you want to answer the question that was posed to you about 8 minutes ago?
Yes, sure. So I found an article that was recently published a few weeks ago.
Restate the question. What was the question again?
So the question was whether or not blood type had any relation to the outcomes of having COVID. And there was a study that was published about 2.5 weeks ago about the relationship between ABO, blood group, and COVID-19 susceptibility. It was not peer-reviewed, but the results showed that blood group A was associated with a higher risk for acquiring COVID-19 compared with non-A blood groups, whereas blood group O was associated with a lower risk for infection compared with non-O blood groups.
Interesting. Okay, well, there's your answer.
Translate it for us. One sentence.
Well, it has something to do with the red blood cell, probably antigenicity, the proteins on the surface of your red blood cells. We know that red blood cells are important in, obviously, oxygenation, and I'm not quite sure if that affects your infection rate or your outcomes. Just keep in mind that every paper that is published these days is not going in for peer review. So essentially, you can publish just about anything you want. So whatever you hear in science, you have to take with a grain of salt right now, because most things are not going through the peer review process, particularly things like the data with hydrochloroquine. So as much as I appreciate that maybe AB does worse than O blood type, I take it with a blood of salt, if you will. All right, Flora, you want to wrap it up?
Yep. Thank you guys so much for coming today. We're going to add this link on the chat where you can submit more questions if you have any residual ones for the doctor and Peter and Danny, and we'll get to them next time. So definitely feel free to use this link. Also, we're just going to add the link to make an appointment with Dr. Boockvar, because he is still taking appointments, and everybody knows that only emergencies are going to be taken into account right now, but that doesn't mean you can't make an appointment and come in. And we're going to have Umar here next time. So definitely tune in next week at 4:30, and we'll be back.
Thank you, everyone.
Thank you, everyone.
Everyone.
Stay healthy. Bye-bye.
Bye.